Good effective compression, you are building up pressure in the system, which will move blood around the heart
to tilt the head back. Now, hello guys, welcome back to my YouTube channel Swastik Dental Academy. Myself Dr. Vikas Kaushik, oral and maxillofacial surgeon. So today we are going to discuss about CPR, cardiopulmonary resuscitation. So let's start with this video. Guys, as we know that cardiac arrest is the most serious complication faced by any medical or dental personnel. An immediate diagnosis and immediate CPR can prevent many deaths. So now we are going to discuss about what is cardiac arrest. In cardiac arrest, circulation ceases or stops and the vital organs are deprived of oxygen, or we can broadly define as inability of heart to sustain an effective output. So what are the etiological factors of cardiac arrest? Number 1, cardiac disease, hypotension, hypoglycemia, hypoxia, fainting, effect of drugs, electrolytic changes, vagal reflex mechanism, and terminal stage of any disease. Diagnosis of cardiac arrest can be done by examining pulse, respiration, auscultation of heart, pupils, skin color, and general condition of patient. Now we will discuss the treatment of cardiac arrest. CPR is the most effective when started immediately, and it should be initiated by the person present at the time of cardiac arrest or when the patient collapses. Management of CPR are of two types. One is outside the hospital and one is inside the hospital. Outside the hospital we can call it as BLS, basic life support, and inside the hospital we can call it as ACLS, advanced cardiac life support. Post resuscitation life support is also called as CPCR, cardiac pulmonary cerebral resuscitation. Now we are going to discuss about BLS, basic life support. Major objective of BLS is to maintain oxygenation in lungs, brain and heart with rescue breathing and cardiac compression, by which oxygen is transported to the tissues before ACLS, means advanced cardiac life support. So how we can perform BLS, basic life support? It is a three-part sequence: A, B, C. A means airway, B means breathing, and C for circulation. And each phase starts with an assessment phase. So we will start first with the airway. Airway maintenance is a first part and the most important part of BLS. When patient is unresponsive, first of all you have to position the patient and then we have to assess the airway. So how we can position the victim? The victim should lie supine on a firm flat surface. Airway maintenance is easier in that position. What should be the position of rescuer? Rescuer should be at the patient side equal to the distance of width of the patient's body and at the level of patient's shoulder. There are three ways by which we can maintain the airway. First is by opening the mouth or clearing the airway. Second is head tilt and chin lift. And third one is jaw thrust. Now we will discuss that how opening the mouth can clear the airway. As we know that in an unconscious patient, muscular tone is impaired and it results in obstruction of pharynx by the base of the tongue and soft tissues of pharynx. As we know that tongue is attached to the lower jaw. So moving the lower jaw forward can lift the tongue and it can result in clearing the airway. Now we will discuss the head tilt and chin lift technique. In this, place one hand on the victim's forehead and apply firm backward pressure to tilt the head back. Now place the fingers of other hand under the bony part of the chin. Now lift the chin forward and support the jaw. Now we will discuss the jaw thrust technique. In this technique, we will grasp the angle of the victim's lower jaw and lift it with both hands, one on each side, displacing the mandible forward and tilting the head backwards. What we can do if any foreign body is obstructing the airway? First one is back blows. Give the back blows on the middle of the back 4 times. It will produce cough impulse. Second is Heimlich maneuver. In this, the rescuer will be behind the patient and compressing the chest of the victim 4 to 5 times. Third one is finger sweep method. It is the most commonly used. Now we will discuss the second part of BLS, breathing. One must determine the presence or absence of breathing by number 1, placing the ear near the nose or mouth of the patient. Second, looking for the chest movement. And third one is auscultation of chest for the breathe sounds. There are 3 ways by which expired air resuscitation can be performed or we can maintain breathing. First one is mouth to mouth breathing. Second is mouth to nose breathing. And third one is mouth to airway breathing. So here we are going to discuss about mouth to mouth breathing. It is a quick and effective method. In this, rescuer uses his expired air oxygen to supply to the victim. Number 1, open the airway with triple maneuvers. Number 2, close the victim's nostrils. Number 3, take a deep breath and form a seal with lips around the patient's mouth before exhaling. Number 4, 2 slow breaths are given to provide good chest expansion, and it also decreases the possibility of gastric distension at the same time. Now we are going to discuss about third part of BLS, basic life support, that is C, circulation. Carotid artery is the most easily palpable between trachea and the large strap muscles of the neck. Carotid pulsations are felt when no other pulses are not palpable. If carotid pulse is not palpable, then immediate start external cardiac compression to establish circulation. So what is external cardiac compression? In this, rescuer applies pressure over lower half of the sternum, approximately 80 to 100 per minute. These compressions provide circulation as a result of generalized increase in intrathoracic pressure due to direct compression of heart between sternum and vertebrae. When compression is accompanied by rescue breathing, blood is likely to carry oxygen to the peripheral tissues. During external cardiac compression, position the victim on a firm, flat surface. Locate the lower margin of victim's rib cage. Locate the lower part of sternum by moving the fingers along the notch where the rib meets the sternum in the center of the chest wall. Place the heel of one hand on lower half of the sternum with the other hand on top of the first hand in such a way that the long axis of the rescuer's hand is placed on the long axis of the sternum. This helps in keeping the force of compression on the sternum. Fingers are kept interlocked at the chest. Rescuer's elbow should be locked into a position such that The arms are straightened and shoulders are placed directly over the hand. For normal size adult, sternum should be depressed approximately half to 1.5 inch by force. Optimal sternal compression is the one which can generate adequate carotid pulse. Rescuer should release the pressure after each compression to allow the blood to flow into the chest and heart.
Our heart is an amazing organ. It works hard for us every second of every day, delivering blood and oxygen to every cell in our body. But when sudden cardiac arrest strikes, our heart suddenly and unexpectedly stops beating effectively and blood flow stops. Without any intervention, the brain, vital organs, and our heart will begin to die. Beginning CPR is the person's only chance of survival. Brain damage will start to set in within 4 minutes, and after 10 minutes, brain damage becomes irreversible. The power to save a life is truly in your hands. Performing CPR accomplishes 2 critical things. 1. Compressions move oxygenated blood to the brain to keep the brain alive. And 2. Compressions keep blood and oxygen moving to the heart muscle itself, so that it has the best chance of resuming a normal electrical rhythm after a shock is delivered. As you begin compressions, you are creating an artificial pump and doing the work of the heart manually. With each good, effective compression, you are building up pressure in the system, which will move blood around the heart and up to the brain. It does take time to get the blood moving with CPR, so it is very important to push hard and push fast to build the pressure up, which keeps blood going to the brain. Pushing down at least 2 inches allows for the heart to be squeezed and blood to move out. Pushing at a rate of 100 to 120 compressions per minute is necessary to keep blood pumping. Let's see what happens when we take our hands off the chest. Blood stops moving to the brain. It is for this reason that if you are taking your hands off the chest to deliver breaths or switching roles, it is critical to minimize time off the chest. Watch what happens when we don't push deep enough. Blood does not reach the brain. The same is true if we do not push fast enough. Watch what happens when we push too fast. The heart does not have time to refill with blood, therefore not enough blood gets pumped out. Watch what happens when we don't allow the body to decompress and allow the chest to fully recoil. The heart does not have a chance to refill with blood, therefore no blood gets pumped out. So remember, the key purpose of delivering compressions is to keep oxygenated blood moving within the heart and up to the brain to keep the brain alive. We need to push hard and push fast in the center of the chest. If ribs break, that's okay. What's not okay is allowing the brain to die from a lack of oxygen. So remember, you are their only hope. Do the best you can, and don't give up until medical help arrives or an AED is present. You can do it.
After BLS, we are going to discuss about ACLS, Advanced Cardiac Life Support, which is performed in the hospital setup. Emergency care provided by BLS to restore circulatory function, whereas ACLS helps to evaluate and restore the spontaneous circulatory function. ACLS includes use of adjunctive equipment and technique available in a hospital setup. It assists in ventilation and circulation such as ECG monitoring, arrhythmia recognition, and defibrillation, and establishment of IV access and use of drug therapy. Key points of ACLS are divided into 2 parts. First ABCD and second ABCD of ACLS. In first ABCD of ACLS, A stands for airway, B stands for breathing, C stands for circulation, and D stands for defibrillation. Second ABCD of ACLS. In A stands for perform endotracheal intubation. B stands for assist ventilation. C stands for circulatory support. In that it includes gain IV access, attach monitor, measure BP, identify rhythm and provide appropriate medications. And D stands for differential diagnosis, find and treat the cause. Drug therapy is the secondary management to the most fundamental interventions. Following drugs are used: adrenaline, atropine, xylocaine, calcium and sodium bicarbonate. Finally, we are going to discuss about outcome of resuscitation. It depends on many factors. For example, age of the patient, cause line factor, rhythm and ischemia time. Here the neurological recovery is 50%. If arrest time is less than 6 minutes and CPR time is less than 15 minutes, then the outcome will be satisfactory. But if the arrest time is greater than 6 minutes and CPR time is greater than 15 minutes, then the chances of survival are nil. Guys, I hope you will like this video. Please like, comment and share this video, and please subscribe my YouTube channel if you have not subscribed. Thank you for watching this video.